Something tells me that I should make a little video about how I'm feeling. I'm really excited to get the implants out in like 10 days because, number one, my hair sucks. Remember that long, dark, beautiful hair? No mas. The reason why I cut it short was just because it was not as healthy. It just seemed like, oh, it's just not as nice. Let's just start over. It just doesn't want to grow back now, and it's not that thick. And one of the main symptoms of BII is hair thinning and losing your hair. So that's nice. Another is thyroid. After a year of 3 different doctors, 3 different medicines, 6 or so different doses, can't get that right. Can't get the dosage right. My thyroid is still not functioning at the way it should, which is kind of the gateway to your metabolism. So, weight gain has been super frustrating, and weight loss has been nearly impossible. I did a 5-day cleanse and lost 0 weight, not even water weight. So very, very frustrating. I think the short-term memory loss stuff is a real thing. And I think energy too. I just have such a strong mindset that it's hard for me to just sit around. But I have to will myself kind of every day. I guess that's something I've never put together. It's not just natural bubbly energy. It's just a will to not sit around and do something. Go work out. Go do this, stay busy, stay moving around. So it's not really supernatural. It's not just there and ready to go. I will it. So, and recovery from workouts has been crap. And then there's all kinds of other markers like testosterone, DHEA, vitamin D, magnesium, estrogen, progesterone, literally all my hormones, everything's just low. It's kind of just shut down city. I want to describe my symptoms first because for those watching that are interested, I think this is the most important thing to start off with. So I'm going to go down the list and then we'll hit on the big ones. The shape of my face and swelling, swollen lymph nodes in my neck. My hair was thinning and breaking off, dry scalp and dry skin, weird underarm smell, sometimes just one armpit, not the other. Recovering from workouts and I'm training for the Boston Marathon. I needed 2 days to recover, and the girls that did it with me were ready to go that night. So recovery was terrible. General fatigue, not extreme, but definitely laboring through my days and not feeling kind of that normal kind of bubbly energy. Heavy metal toxicity, which was tested from with a provoked urine test. Leaky gut, also tested. Dysbiosis, also tested. 10 out of 10 dysbiosis. Hypothyroidism. So that was kind of the first thing that came along for me. I was like, oh my God, this is the answer to everything. My thyroid is low. That was just scratching the surface. Weight gain and resistance to weight loss, nothing I did made a difference for years and years, 4 years or more. Capsular contracture. That's just a side effect of the implants. So you have the implant and then your tissues form a capsule around it. When there's blood or rupture, that makes it even more, it makes a thicker capsule around it. And so I actually thought that crashing race cars maybe was doing that. And so I had it tested and it wasn't. And then the other one did it after I was done racing. So that wasn't it. It was just my body producing tissue to protect myself. And the implants were folded within the capsule. So they were really tight. Elevated CRP, which is just an inflammatory marker, low testosterone, low vitamin D, low DHEA, low estrogen, low progesterone, low white blood cell count, low magnesium. All those were tested with blood tests, and urine and saliva and all the things. Adrenal fatigue. So this was done through a urine test, but you normally wake up and your cortisol goes up, and mine spiked in the middle of the night, probably from hypoglycemia. And then it just kept going down all day. So that's kind of indicative of your adrenals not functioning properly and giving your cortisol a rise. So adrenal fatigue. Dizziness. I've noticed that my dizziness is better. So it kind of was there before, but dizziness, standing up. Temperature sensitivity, just being too hot or too cold all the time. Every now and again, so some people have really bad achy hands and achy joints, but my hands kind of did it a few times to me, and I'm like, what is this? This feels like arthritis, but it wasn't constant. And then maybe some short-term memory stuff, like talking to somebody and just forgetting what I was going to ask them. I don't know if that's normal or not. Probably not. So those are my symptoms. There are others for those watching that are curious. There's the big hitters that I didn't mention that I had, because I watched over at least 100 women's stories through Instagram, YouTube. A lot of them also had brain fog, anxiety, and depression, and extreme fatigue. And so I wouldn't say I had those, but if you're watching, some people do. I just didn't manifest those. I mean, now if we go back in the story, because look, getting my implants out, it wasn't like I thought, oh, I'll get my implants out and then I'll be better. I only started talking about it so quickly after because I got better so fast. Like within hours, there was a difference starting to happen. But everything I did along the way, I thought was the thing. If we go back to 2018, my indicators were resistance to weight loss, like gained a few pounds and couldn't get it off no matter what I did, no matter what I ate, no matter how much I worked out. And looking back, my hair too, like it just kept getting less thick and healthy and long. And eventually that's kind of why I cut it, was because I thought, well, it's just not healthy anymore. Maybe I'm just aging. I mean, how many out there like think I'm just aging and this is why? So I thought maybe I'm just getting older. My hair is not the same. And so those were kind of my two indicators that I had about 4 years ago in 2018. And then fast forward to 2020, then I'd say another wave of weight gain, which was just punishing. At the end of 2020, beginning 2021, my cycle was getting later and later for a couple months, and then I skipped a couple months and I thought, I should probably go get this fixed. And honestly, it was a godsend because I just kept thinking I should just try harder. I should just try harder, right? And so I went in and had a blood draw and, a bunch of lab work done. I thought 9 vials was a lot when I got my blood drawn that time. Oh my gosh. Fast forward to later, I ended up having like 19 drawn for my leaky gut test. But anyway, so I got my blood drawn and my thyroid was low. I mean, there was other things too, for sure. But I thought, man, that's it. That's going to explain weight gain. That's going to explain hair loss, because that's another thing from thyroid, dry skin, dry scalp, like those. Okay, all of a sudden I'm like, here we go. And I remember when the doctor gave me thyroid pills for the first time, and I thought, this is it, this one little pill. And it was like a tiny little dose of, it was a natural desiccated pig, because you can either have synthetic or desiccated pig. And it was the desiccated. So it was a natural one. And I thought, oh my God, this is the solution. And that didn't do anything. And then I doubled it and I thought that will do it. And then that didn't do anything. And then I added more and then that didn't do anything either. And so that was kind of just starting the process at the beginning of 2021. That was April of 2021. And from there, my doctor said, look, because he was just my OB. And so he's like, I think you should see a functional doctor. And I'm like, okay. So I managed to get in with a functional doctor. And in the meantime, I also was introduced to Ben Greenfield's book, Boundless. And I thought, wow, this is fascinating. And I thought I should interview Ben Greenfield. And so Ben Greenfield is like a biohacking guy. And at the end of the conversation, I said, if I wanted to know like what to eat, when to eat, how to work out, when to work out, what would I do? And he's like, take these tests. And so I ordered all the tests. And now I understand I'm fortunate. These tests are not cheap. And so I spent a ton of money on tests. I got all the tests. Then I started working with the functional doctor. And so between the two of them, I realized that so many things were going on. The one really big one that popped up was heavy metal toxicity. And so I had insanely high mercury. Like it has to be under 5 to be, I think, in a tolerable range, or a range that's not above the threshold. And mine was 170. So I had insanely high mercury. I also had 4 other metals that were elevated above the threshold. So heavy metal toxicity, leaky gut. I mean, when I got the results from my leaky gut, I was like, what am I going to eat? Like, I mean, cinnamon was on it. Like everything was on it. And so I went on a 90-day gut protocol for that, where I, cut out all the things that were high, only a couple things that were moderate here and there, just because I literally could only have like 4 proteins. And how much cod do you really want to eat? So I had a very restricted diet for 90 days, on top of probably taking 20 to 30 pills a day. Then dysbiosis was another one that popped up in the test. The one thing about dysbiosis, I was a 7 out of 10 when we first tested it. Then I was a 10 out of 10 when we tested it the next time. And so for those out there that do marathons and heavy training, I think marathon training can make that a little worse. And I was training for the Boston Marathon while I was doing all this. So I want to just stack it high and deep. But the dysbiosis got worse when we retested it a second time. So for the heavy metals, just so people know, what you really want to do is a provoked urine test. A provoked urine test is where you take a sample first thing in the morning, and then you take this drug. It's called DMSA. And so I'd take all these DMSA pills, and then for the next 6 hours, you collect your urine, and then you make a sample out of it. And basically it pulls out of your body into storage because it gets stored in fat cells and all over the place in your body. So that kind of gives you more of your long-term load, as opposed to just a blood test is testing more recent. Yeah, I mean, I went through all that. I thought thyroid medicine was going to be the cure. Then I thought leaky gut protocol for 90 days is going to be the cure. And then I thought heavy metals, infrared sauna, sweating, getting that out. And then eventually I did chelation, which is where you take that DMSA, but you do it every day. There was sort of a cycle. It was like 5 days on, a couple days off or something like that. So I did chelation to try and get rid of it too. And I literally thought all of these things were going to do it. I thought this is where I'm going to feel better. And every single time I went to the doctor and I said, I don't feel any different. I don't look any different. Nothing changed. Then I started working with another doctor at the beginning of 2022. A great doctor, still working with him right now. Ben Greenfeild introduced me to him. I started taking peptides. And so I thought, this will be it. I'll take peptides and this is going to help me feel better and look better. And I took peptides, and I mean, like, for someone like me, like, I hate needles. And the fact that I stuck myself with up to 3 needles a day is really saying something. So took the peptides, again, reported back with really don't feel any different, don't look any different. So that didn't work either. And the one good thing is we did cut out a lot of pills when I went with the doctor that I'm with now. He's like, just stop taking it and stop stressing. And he's very much about mindset and being really positive and thinking positive thoughts. And to not be overwhelmed by things. So I did like that a lot. We also tried new thyroid medicine. So I tried thyroid medicine from my OB, a different thyroid medicine with my functional doctor, and then another different thyroid medicine in which I take a T3, T4 combo in the morning, and then 2 more times in the day, I just take T3 alone, because T3 is what is active in your body and goes into every cell of your body and gives you the energy. It's basically, I mean, it's your metabolism, it's everything. And so I take it 2 more times in the day, and all of that still doesn't make my T3 go up. So nothing works. So if there's one thing that I can say that I feel like I've gathered from watching all these women's stories, my own story, is that nothing works. Like, the symptoms are all over the place. If you're going to look up breast implant illness and you're going to look at the symptoms, there's 100. I mean, there's just anything, but it's really just how your body is going to manifest with trying to get rid of something. And is it through inflammation? Is it through fatigue? Do you have gut issues? Is your skin? Some people get rashes. Like, however you manifest is personal to you. But the main point is that you can't fix it. And so I didn't go into getting my implants removed thinking like, oh, this is the thing. Like, I thought everything was going to be the thing. And so when I got them out, I mean, first off, I was really excited. I was over them. They were hard. They had capsular contracture. I was ready. Woke up after anesthesia, came home, and my mom said I came to pretty quick. So within like 2 hours, I'm sitting on the couch, and I remember I put my hand on my face, and I was like, oh my God, Mom, my skin is producing oil for the first time. I have not felt like what it's like to have like oil on my face. I don't remember the last time, which is exactly why my skin and my scalp have been dry. And so my scalp isn't producing oil, so it's dry, and then my hair goes to grow and it's not getting any nourishment, no moisture, and it's just breaking off before it has a chance to get long. And so, and I'm sure thyroid and other things play a factor too, but it's like, oh my God, I was so relieved to finally realize, like, I have skin that produces oil. Then I woke up in the morning, and I mean, all I took for drugs was I took a hydrocodone at surgery was over with at 4:30. I took a hydrocodone about 9:30 p.m. Another one at about 4:30 in the morning when I woke up. Managed to get back to sleep for a little bit, and then I took a Tylenol at noon, and I took one more Tylenol at about 9 p.m. before bed, and that's all I took. So, minimal on the drugs. But I woke up in the morning after surgery and I'm pacing around the kitchen and I'm just like, I realize I'm pacing around the kitchen. I'm like, Mom, I just have a lot of energy. And so the fact that I'm like fresh out of surgery within 12 hours, I'm still on drugs to some degree. And I just feel all this energy. We went grocery shopping and, we're doing our day. Went for a walk with the dogs very easily. From there, more things that changed was my face. I mean, I think that was something that people were following me. Like my face looked different that night and my face is changing every day. And the inflammation that's coming out of my body, like my clothes fit better. And it's only been a week from the time I'm recording this. So everything, my lymph nodes in my neck have gone down. I mean, you can barely feel them. They're barely sticking out. Like that was such a relief because I could feel them every single day. I could feel them when I moved, when I ate something, like they were just, I could just feel it. And I just have been recovering so quickly. And so this is a journey I just felt compelled to share. I felt compelled to tell people how much better I felt and to let people know that, if you're struggling and you have implants, and you can't fix it, there could be something wrong with them. Like they could be making you sick. And I just thought it was an important message for people to know because I tried so hard and I tried so many things. And usually that's the case. I mean, even if you don't have as much time and energy and, flexibility with money, most people try so many things. And so I just hope that if you're out there and you're struggling, that you'll entertain this idea and you'll start watching the stories and let your intuition guide you. Right? There was a seed in my head that was like, could this be it? And I'm so glad that I listened to that. Your intuition is a really powerful tool. Feel into that. And I'll keep sharing how it's going because this is only 1 week post-op. So I'm sure that things will change after a month and 6 months and 12 months. And I have testing to do still. I'm going to retest my gut. I'm going to retest the heavy metals. I'll retest all my blood markers for all my endocrine system, hormones. I mean, all that stuff needs to be retested, and I'll share, how quickly that changes or slowly. And out of the long list that I started off with of what I've been dealing with, I don't know if all of them are going to be taken care of by getting the implants out, but I made the list to see just how many can be checked off. And I'm honored to share that journey so that I can help others in their journey themselves, because it was through watching them that I felt not so crazy and where the mission to get these out really, really sank in, because I saw so many stories of women feeling better. So if you're struggling, I hope that you figure it out. And if this is it and I'm a part of it, I'm happy to go through it. So I think it's really important that we get nitty-gritty details from a doctor. So I've asked my doctor, Shaun Parson, if he will come on here, and he's going to sit down with me and we're going to get into some of the details and hear from his perspective, what he's seen in his practice, what women's symptoms are, how they get better, what the drug companies are telling him. What does he hear from his perspective so that we can understand better what the doctors are dealing with? Thank you so much for sitting down and doing this.
Absolutely.
And also thank you for doing great surgery on me. Was I a tough patient?
You weren't a tough. For me, you were fine.
I mean, I was asleep, so not like that. But was my operation a tough operation?
No, I think you're petite, so it was kind of it was like a reverse delivery of a baby. You know,
I don't know
well,
what that's like.
well,
I don't
I
have
guess
children.
delivery of a baby, you know, not a reverse delivery of a baby, but you know,
So it's tight to get it out.
going through, you know, a larger object through as small a
Yeah.
little spot as we can.
You can describe. So, I mean, we went through the nipple and like we did an end block and like go ahead and explain like exactly what was done.
So years ago when you initially had your original
Mm-hmm.
surgery, the surgeon had chosen to make a small incision on the lower portion of your areola.
Mm-hmm.
And so rather than trying to make some brand new incision, you know, if at all possible, I want to try to not make extra scars.
Yeah, I like that.
So I went through the same. So you kind of go through the same scar, come down on the implant capsule, the scarred area. So kind of go through breast tissue, get down on that, and then with cautery, you kind of asked me earlier.
I did. I wanted to kind of know the details just a little bit, like what happens in there.
So there's, I mean, some scissors, but cautery, just so we, you know, kind of cauterize as we go, and you just create a plane. It would be like if you've kind of encased something in, say there's a little marble and it's encased in foam, and you want to, you know, go down and then chip away all the foam, but not just obviously just, you know, you want to just take that one little marble out if you can. So clean all that. Sometimes it's more attached to certain spots. Yours was a little bit more attached to the muscle. So on the upper portion, it was attached to the breast tissue. Underneath, it was attached to the top of the muscle.
So would you say that it was more stuck, more attached than some other implants?
Yeah, for sure.
Got it.
And I think, you know, think of it as your body's trying to wall off that device. Yeah. But it's also, the scar's not that smart. So the scar is also stuck to the area outside of it, as well as trying to wall off on the inside.
I see.
So it's just really trying to fixate and not let that thing go anywhere.
And the capsular contracture, I mean, you know, like I went to see you for one that had capsular contracture in, I think it popped up in like 2018, but I might have seen you in 19 for it. And then the other one ended up doing it too. And so somebody asked me on social media, how do you know if you have capsular contracture? And I posted that video and said, you'll know, right? Like, you know. So maybe some indicators on that. And then also there are levels of it. And I think you said I was maybe like a 2-3 on there. Is that, was I more like a 3 once you got him out?
I think you're a 3 for sure. I think
out of 4.
Out of 4. Yeah. So it's basically more of a subjective scale. So if someone has an implant, I don't know why when it was set up way back when it wasn't, you know, 0 to 10 or 0 to 5, but it seems like 0 should be perfect, but 1's as if there's no implant in. So there's very little scar. Yeah. 2, there's noticeably some firmness to the breast. It may still look fairly aesthetically normal, but there's firmness that you can feel, and maybe there's a difference between the two sides. 3 really starts to kind of physically distort the breast a little bit. It's more firm. Maybe the breast pulls up, but it's not the normal shape that it had been in the past. Right. 4, I mean, can get to the point where it's, you know, almost like a rock, you know.
And they can be painful too, right?
Yeah, and even if they're not so firm, if they start to have components of pain, it automatically kicks you into a 4.
So I noticed with mine that when I push on it enough, like because they're firm, you know, if I pushed on it, it would be sore. It felt kind of like achy sore. Yeah. But if I didn't push on it, it didn't hurt. Right. So maybe that's also another tool that, you know, people can use as an indicator to see how much and that, you know, because it definitely was an issue.
It hurts. And we've got different nerves. We've got different nerves in our body. We've got nerves that are temperature nerves. We've got nerves that are, you know, if you get pricked with a needle, that's more of a pain fiber. But we've got stretch nerves. So, you know, our intestines, we don't have to know if something's going to poke us with a needle, but it's super important if your stomach starts to stretch too much or your colon stretches. So we've got stretch fibers in our intestine. But when we start to get that tightness, the stretch fibers are sometimes getting kind of twisted or pulled, and that's sometimes why it hurts.
So part of the reason of going to you was, yes, you were referred by my original doctor in North Carolina. I had already seen you once, but I was more than happy to go to a new doctor if I had done my research and found that there was someone else that had rave reviews. However, that was still you. en bloc and explants is something that you in particular have been doing a lot of. So how did that come about that you ended up doing so many of them? And how long have you been doing so many of them?
So I've been in practice for 25 years. When I started my practice, I trained at a place where we did a lot of chest surgery.
Okay.
So I trained at Mayo Clinic in Rochester, Minnesota, and we were very busy with cardiothoracic surgery. And my program chairman there was particularly very good nationally and internationally at chest wall reconstruction. So I had a basis there. And then when I started my practice here in Scottsdale, I did a lot of breast cancer reconstruction.
Okay.
There's components of an en bloc capsulectomy with that. Some, there's you're using implants or taking implants out or doing lifts or doing all those kind of component surgeries to make people match. I kind of tell people I'm not your guy for 15th time nose surgeries in town, but I do a lot of breast surgery. And then as time's gone by and as breast implant illness has become more of a thing and a topic, and women have approached, and had the courage to approach people because they don't feel well and they're having issues and they're not sure why they're having issues. And, could it be their implant? Is it something else? They don't know. I started to get approached more and more for those. And I think it was kind of a natural process with that. I did a lot of breast surgery. So some of those patients started to come to me, and then we had good results, and we had, it's important to make somebody feel better, but it's also important to have them look as good as they can possibly look.
Yeah.
So I think anybody can take the implant out, but you also want to take it out so things look good.
What would you do if someone wanted their breast implants out, if they felt okay versus if they didn't feel okay? Would you do that differently? Yeah.
So just from a terminology standpoint, capsule again is the scarred wall that forms around anything that's not you.
Yep.
So if you have an infection, you can form a scarred off area. If you have a knee replacement, if you have a heart valve, if you have anything that's artificial, your body doesn't know what it is, so it just wants to wall it off. And in a perfect world, it's very thin, kind of no big deal scar. As that scar starts to become more and more involved, it can hurt or it can hurt and form a capsule. And then take that in the next step. If you're having issues where your body's maybe really not liking that implant and having maybe symptoms with breast implant illness or things like that, it really starts to, you get this like chronic inflammatory response to just having that device in there. So capsule's the scar. Capsulotomy means I'm cutting the scar. So you could go in if you just had a firm breast and do a capsulotomy and just kind of open things up. So it's really closed, then we kind of just open it. Again, that's
take the implant out and then
depends.
Or just
and so the implant manufacturers actually, if you're having issues with the device, they're like, hey, that's, we warranty our device for a certain period of time. We'll give you a new device if you want to go down that road. If you're forming too much scar tissue, too much scar tissue around. Again, that's not BII. That's
right.
That's just you're forming scar
not
tissue.
Happy with the
I like the way it looks. Everything's fine. It's just getting firm. So that's a capsulotomy. Capsulectomy means I'm taking out most of the implant. Most of the capsule. If I take out over 50%, it's technically a capsulectomy. Total capsulectomy means I'm taking out the entire thing. En bloc capsulectomy means I'm taking it out in one piece. I'm not trying to leave anything behind. I'm not trying to take out half of it and then take out the other half of it.
So even if when you do an en bloc, let's say there's the implants exposed or something like that, like you didn't quite maybe get all the scar tissue, would you not be able to call that an en bloc, or would you still call that an en bloc if you still took it out with what you did your best to get?
If you're really technically doing an en bloc, it's coming out in one piece.
Yeah.
So if you start to piecemeal it, even if
it's tissue.
Yeah, then you're really doing a total capsulectomy, not an en bloc total capsulectomy.
Okay. So was my story uncommon?
No, I think I think that I have a unique position where I'm probably getting approached more and more. So it's becoming more and more common for me.
Sorry,
to hear
I'm probably going to make that happen some more.
but I think that I think your story is a little uncommon in terms of you're very fit, you're very strong. You saw this rapid decline, and so I think you're seeing a rapid, rebound. And I think you're unique that you're an athlete and you're able to really, give your body and everything, externally and internally that it can get.
And that I have you mean that I have a hyperbaric chamber in my bedroom?
Maybe that, yeah. So those things are maybe unique to you, but I think your rebound's a little faster.
Yeah.
But I think that it's not.
But my story of
your
struggles.
story's not uncommon, and I think your openness to share your story maybe is unique and to be applauded. Because I think a lot of people may tell a friend, but they're not on the platform to tell as many people as you're telling.
Yeah, I wasn't sure I wanted to.
But I think that people, I think it's great that you're willing to do this. I think it's great that it'll give people, validate some of the things they're feeling, and that it's okay, and that it's okay to take your implants out, and it's okay to ask those questions.
What do the drug companies say? What are the drug companies that make implants, make breast implants? We're just talking about that. So there's Allergan?
So the main companies in the United States are Allergan, Mentor, and Sientra. Okay. There is Ideal as another company, but the main two from a market share standpoint are kind of Allergan and Mentor. Okay.
And so I'm guessing they tell you that they're safe. And I'm guessing that you put effort in to pick the right companies. And, I'm sure that those are probably the majority. But I'm curious from your perspective, what they share with you and what your dive is into their research, because it's their research on their product.
So to go back in time. So back in 1992, remember Connie Chung?
Yeah.
Okay. So, and again, fact check me, but there's an expose, David Kessler at the time was head of the FDA. And, she did a story and released a story and said, hey, I don't know if these, implants may be causing autoimmune disease. Mm-hmm. And they had been kind of grandfathered in from an approval standpoint. They hadn't had to jump through as many hoops as other devices may have had to jump through. Okay. And so at the time, Kessler was like, whoa, maybe this is something, maybe there is this autoimmune thing. So they were pulled off the market. Mm-hmm. All silicone implants in the United States were pulled off the market. Now in other countries, Canada, Europe, they were like, wait, what? No, we don't see that. So this is just something going on in the United States. Okay. And in other countries throughout the world, they're kind of still doing their thing. Okay. So I was in practice during that time. The only way you could put in silicone implants, you could still put in saline implants, but silicone implants was through study investigations. Okay. I actually had people in my office whose sole job was just to run the study. Oh. Because it was that big of a thing if you were doing, for breast cancer reconstruction or whatever, any use of silicone implants. And they kept doing studies and doing studies and doing studies. And they just, it's easy when you're doing a study to find bad results. And then you're like, oh, okay, these are horrible. Yeah. And they kept doing them and doing them and doing them. And it's you got to do a lot to finally like, well, we just can't find any data that links this to autoimmune disease. So they were, after doing all those studies, those companies were able to put them back on the market through the FDA, through normal channels. Mm-hmm. And then over the last, say 6-7 years, 5 years, it's really ramped up. Then there's been this other issue called breast implant associated ALCL or a lymphoma-like reaction that's not BII, that's been seen with textured surface implants. Mm-hmm. So now
I've watched a lot about that. It could cause cancer.
It causes a lymphoma-like reaction, and people can actually die from that. So they're treated the same way. They're treated with an en-bloc capsulectomy. They present differently. They don't present with BII symptoms that it's your breast, all of a sudden one breast usually gets quite larger and there's fluid around. So it's a different thing, but it's treated the same way. Okay. But because of that, some of these textured surface implants have been taken off the market.
Yeah.
Okay. And then over the last 6-7 years, BIIs come on the forefront where people are like, I don't have a cancer. It's not anything. I just don't feel great.
Yeah.
And I'm not sure why. And I'm seeing a lot of things on social media that other people show, and so there've been support groups and pretty much in every community in the United States, there's been different support groups. Some plastic surgeons are more hard science driven. So they if they can't find a study, they're probably, I don't know if I really buy into that. Others, I think, are willing to say, you know what, I'm not sure, but I've seen people get their implants removed and they really feel better.
Yeah.
And
you've seen it.
I've seen it.
So do you believe it? It's
do.
real?
I believe that there's women who I've personally seen over and over and over again who you take their implants out and they feel better.
Yeah.
Now, no one's the same, and everybody has different symptoms.
Exactly. There's over 100 different symptoms and I'm not the normal case, But, it's not the norm.
No. And I think it's a small subset of the population. I think the majority of women do fine with implants. I think it's important to say, and with all different biomaterials, most people do fine. But I think the one thing I think I said to you at one point, I think it's naive to think that every human reacts the same.
Yeah.
I think there's so many people have allergies. Yeah. People have allergies to antibiotics.
Yeah.
Right. So we still use penicillin, but penicillin can kill certain people.
Yeah.
That doesn't mean we've abandoned the use of penicillin.
Yeah.
And you don't know that someone's going to have a reaction to an antibiotic until they've taken it. You don't know they're going to have a reaction to an implant until they've had it in. But I think it's naive to think that they can't have a reaction. But I think what I see when it's really truthfully implant related, they've done their homework.
Yeah.
They've seen doctors. They've seen a lot of doctors sometimes. Yeah. They still feel lousy.
Yeah.
And I think then you maybe need to start refocusing and ask yourself, okay,
got it.
I've really done my homework and I've really tried to right the ship. And certainly we'd never want to have someone just jump into surgery.
Right. That wasn't my first thing on the list either. I didn't say first stop surgery.
No.
First stop was pill for me. Right.
And then,
and then IVs.
Well, then, first stop for you is like healthy diet.
Yeah.
Exercise.
Exactly.
That doesn't work. Okay. Well, let's look at blood. Let's look at maybe medication needs to change.
Right.
Let's do supplements.
Yep.
Let's just get my body so it's homeopathically better.
Yeah.
And as optimized as possible. And if that still doesn't, okay, now what?
Exactly. Well, then what are their options? Because, I don't have a lot. So, getting them out, it doesn't mean that I was not in a situation where I had a lot of extra tissue or anything like that. And so, it was a very simple and straightforward, but that's not the case for all women.
No.
So what are their options for, making them look their best outside of implants?
So like to your point, I think if you really have breast implant illness, I can't promise you you're going to feel better.
Oh yeah. I didn't know either. That's why I all of a sudden shared it. Cause I was like, I can't believe I feel better. Cause I didn't know if I'd feel better.
Right.
Like you can only know by doing it.
Right. And so I think that's the thing because we don't know why people are reacting. So we can't pre-test.
Right.
But I think that if you decide it's the right move to take the implants out and give your body a break and just see, you really need to give it a break and take the implant out and not put another implant back in. Mm-hmm. You can always do another surgery down the road if you decide you don't like the aesthetic look or whatever, or if it didn't change anything, you can always revisit it. But you need to give your body a break. You can do fat transfers. So, fat is a really powerful tool now for plastic surgeons where we can, add volume back.
Right.
And not all the fat will stay, about 75%. Right. 75%.
Do you usually have to come back at least one or two more times to kind of, balance them or add or?
It's really common to use fat transfer for facial aesthetics or for breast reconstruction or for this kind of thing where we're taking something out and we're trying to, reuse you instead of using something artificial. Right. It's just you're fat. It's not going to cause, issues with cancer or other issues. We're just moving it from point A to point B, which is kind of plastic surgery 101, is flaps and fixing things that are broken.
Right.
And so it's a great way to restore some balance without exposing you to anything that's artificial.
I'm glad that there's other options. I think that, for some women it's a real thing. And, I'm grateful that you did such a good job with me. So thank you. And thank you for sharing the information about it. I think this will be really informative for people and give people information about, what to look out for and what to do. And in the meantime, you might get a little more busy with some explants. Sorry about that.
Yeah, no, I appreciate you having me on, and I'm really, really glad you're doing well. Yeah, I'm glad you're having a good result and you're just feeling better.
Too well, you said.
Yeah, take it easy.
I'm just out on a little walk because I have so much energy. It's hard to convey that in a picture, so I thought I'd just give a little story about it. Like, I woke up after surgery and I was walking around and I was like, Mom, I just have so much energy. And for so long, I always did everything I needed to do, but I kind of efforted for it. I had to get myself up. I had to say, come on, and I know how to try harder. So I did. Now I just feel this natural energy. Instead of feeling okay, I got to go do this. Now I feel like I'm almost bubbling with energy, ready to go do something. So, feels so good.
Thanks everybody for listening to the Pretty Intense podcast today. I hope you enjoyed it. If you like what you heard today and you want to hear more, please click on the subscribe button.